Hey, how's it going? So I have the professional model Scenar for a demonstration. I was just looking at what's needed. So to turn on, you have the sliding port. When you turn it on, it will default to 90. This one defaults to 90 hertz, 90, which is fine. My professional unit is blue and it defaults to 60, which is perfectly fine. When you get upwards of 90 or higher in the pro unit, you can go in increments of 1. So if you scroll, so use the down arrow key, you start out at diag 0, go down FM or AM, FM, damp, and then frequency, and you can change the frequency by pressing the plus, and you can go higher, and it goes up. You can go down in frequency. You might have to go around the world, as I put it. So the down arrow, get to frequency, and then you can hold it, and you can go down. So it's back to 90. You can go down to 60. It's like 59.6. So it's that's fine, and that's usually where we start out, is at 60. So that will tell you the basics. Okay, so with that, you can drag on the skin. Okay, if you drag across the skin and it gets sticky, then that is the area where you spend more time. It is saying there's inflammation there. So depending on what body part you're using this for, if it's a hip and it gets sticky, or a low back and it gets sticky, then you spend more time there. Can you hurt yourself with Scenar or hurt someone else with Scenar? Pretty much no. The only contraindication is a newly pregnant woman. So the frequency will interfere with the developing embryo. So we don't recommend using Scenar until the 3rd trimester and staying away from the baby. This does go into standby mode if you don't use it, and you get a little tone saying, hey, I've shut off, to help you protect your battery. We have used Scenar on a distal, so away from the heart, on an ankle. We have had someone hooked up to telemetry and use the Scenar while they look at their pacemaker to make sure there's no interference. That has not been the case. If you're at all concerned, I would not use it on someone with a pacemaker or internal defibrillator, or keep it very distal at the far ends of the ankle or the knee, but not anywhere in the chest. So that's a little mode there. So I'm just gonna turn this back on because it went to standby. You'll notice there's something called diag 0. If you press the plus key, or the down arrow key first, and then the plus key, immediately you'll get to diag 1. In therapy, we like diag 1 because it gives us numbers. Data is good. So in an area that you're suspicious or you have pain, then you can take measurements and it'll give you a number. So if I put the unit on my arm, it gives me numbers. Okay, so the first number it's a number. Okay, the second number is how much inflammation. 7 or 8 is usual. Anything higher than that is telling you there's inflammation there. And this is telling me, okay, I held it there for a second and it was at 38. I held it a little longer, I was at 48, but my inflammation dropped to 6. Okay. You'll get a tone when Scenar has what's called a dose, DOSE. It'll give you a star asterisk, and the body has received a therapeutic dose. You can stay there longer, not a problem. If you have a body part that is really giving you a lot of trouble, then you can work all around. So you can brush around, and if it gets sticky, then you'll want to do your down arrow, put it to diag 1, and then see around as you're in that area, which has the most amount of inflammation, the second number. Then stay there. And you can turn the energy up by pressing the plus button until it's uncomfortable, and then back down just a couple. Okay. I really like on the side port, there is a spot for your tens leads to go in. Now you have the Pro unit, so you might need a different lead with a different connector. I keep all my things in a little bag, and I really like the leads because you can put the you can put sticky pads on just like you do the tens unit, but you can work through and through the knee, you can work through and through the shoulder, through and through the hip, right? So you have a lead that fits in there, and then the two ends attached to the sticky pads. And then you can put the sticky pads, you know, one on the front of the shoulder, one on the back of the shoulder. You can even go digestion. So if I wanted to work on my digestion or my gallbladder, which is up underneath the rib cage on the right side, you'll want to keep the sticky pads close together on the abdominal region, because if you turn the energy up too high, there is a potential to twist the intestines, and we don't want to do that. That would cause an emergent problem. So I've got a bunch of sticky pads, all kinds. I have bigger ones that cover more real estate, like for a back, or so that's what I'm talking about when I say sticky pads, one on the hip, front to back. Okay. So one to the front, one to the back. That'll work through and through the hip, around the knee, either side of the knee. You can go same side if there's problems on the inside of the knee. So really it's following the musculature. So if you have an understanding, or you can look up where the muscles attach to the bone, you can go at their attachment areas, right? So deltoid here and here, right? And when you get up into the neck, so back of the neck at the superior angle of the scapula, so top of the shoulder blade, and you can work up into the neck. You don't want to turn it up too high because it will grab a hold, right? It will take over the impulse of the muscle. So you want to turn it up so that it's slightly uncomfortable, and then go down a couple notches. I think that's enough to get you started. For acute pain, the setting that I really like, and we use a lot here at the clinic, is what we refer to as FM variable. So you're going to turn your machine on. You're going to go to the down arrow. You keep going down, and FM, you want to push plus. Now FM is on. Frequency modulator, FM. What it's going to do is it's going to oscillate between the lower frequency of 14 or 15, and then go to 60, 90, 120, 350, and everything in between. Okay. And it's going to go up and down. So it's going to wave. But that really is a very deep way of getting into the muscle spindle fibers and decreasing the amount of inflammation. And it treats acute pain very well. I have had a knee problem where I dislocated and relocated my knee all in the matter of a second. I stuck the sticky pads on either side. You can go front to back, and I left it on. And I left it on for all the time unless I was taking a shower, because it was a very bad injury. And I wore it almost constantly for 4 straight days. And I worked with it. I rode the bicycle. I kept my joint moving. And I was really better in about 4 weeks. And I probably cut my time down in a third. So it is very significant the way Scenar can help. If you have other questions, please let me know, and I'm certainly happy to answer them. Download this video to your device. I'll save it to my Zoom for about 3 or 4 days, and then it gets deleted. So, or I can hang on to it and post it so it doesn't go away. Maybe that's a better idea. If you have other questions, though, please let me know, and we'll get those answered for you. Thanks so much.